Welcome to the 18 Minutes Podcast. Today's episode is with a special guest, my good friend Mariah from Evoke Therapy Services. On today's episode, we're covering different types of anxiety disorders and different treatment options for those disorders. I'm so excited to have her here and get her clinical expertise. So without further ado, my conversation with Mariah. Okay, so why don't we just get into a little bit about you, why therapy, and sort of your background?
Yeah. Well, my name is Mariah Lord. I'm a licensed marriage and family therapist in the states of Minnesota and Wisconsin. I have a private practice called Evoke Therapy Services, where I offer nature-based sessions and telehealth. And so the nature-based sessions I feel like are particularly helpful for clients with anxiety disorders because sometimes the really clinical, stuffy environment of a therapy office can be hard for someone with anxiety.
For sure.
There's this pressure to kind of make eye contact and just tell your whole life story, and it can feel a little overwhelming for some clients. And so I guess I've noticed a trend in some clients with anxiety disorders reaching out for that service in particular, just because it feels a little more comfortable to be walking together through a park by some water and talking about life rather than in the office setting. So
yeah, that makes a lot of sense.
I absolutely love being a therapist. I really enjoy that my work not only allows me to, but really encourages deep connection, really authentic connection with other humans in front of me. I'm not very much of a small talk person, and so I think that really called me to this line of work too. Just there's not many other jobs where you can just show up so authentically, and I feel so honored to be able to witness my clients' growth and just be very introspective and philosophical in my sessions with clients and be able to laugh with them. And again, I think particularly with anxiety disorders, it's just so wonderful to be able to see someone starting from a place of their world, maybe being really small and closed off, and just witnessing them branch out into the world and achieve their goals. And it's just really rewarding and gratifying work.
Yeah, that's awesome. I love that. That's kind of why I do what I'm doing.
Yeah, absolutely.
It's really rewarding, really fulfilling.
Yeah, and I think that it's really important too, the work that you're doing to be able to speak to your own experiences. And sometimes a limitation of therapy in the therapeutic environment is that as a clinician, I'm not often opening up about my own experiences.
Yeah, totally.
So I think that can make it hard for people to relate and connect. And so I think there's a real need for peer supports and people opening up about their lived experience with different disorders too. So,
yeah, that makes sense. Okay, so can you get into a little bit more about what exactly you kind of specialize in and what you're doing in the context of therapy for anxiety?
Yeah. So as a marriage and family therapist, my specialization is in working with systems. And so understanding how systems work. And in this case, it's relational systems. So even when I'm working with an individual client, my training allows me to really see the person in the context of their environment and how they grew up and their family system that might have influenced them, current relationships that have an impact on their experience, and also the world at large and societal systems at play. So that really comes in relation to identity and factors of their experience that might be impacting the diagnosis that they're coming to get some support with. Usually with most of the diagnoses that I'm working with, it's not like some kind of individual deficit in a person, but more of a how the individual in front of me has coped with the world that they're navigating and how they've learned to cope with different stressors and triggers. Yeah, I really specialize and work with queer individuals. I'd say the majority of my caseload is neurodivergent and holds some LGBTQ plus identity in some way. So I really value incorporating elements of discussions of identity and how it fits into their experience with their mental health into our sessions as well.
Yeah, I can imagine that's a huge deal. And I mentioned this before when the mics weren't working, but being an anxious kid in the 90s, there was really nothing. Like I didn't even really hear the word anxiety, being a kid. But there's just so much more now, and we have a long way to go. But like I said, but it's yeah, we've come a long way with the
Absolutely.
support that is available to people,
Yeah.
and the language we have for things that we didn't before. And
Yeah. And I
yeah.
think that's why podcasts like these are so important too, to get people thinking more about it, talking about
Mm,
it. It's not some unusual experience,
yeah.
even though just by the nature of diagnosing, it can make it feel really, again, like there's something wrong with me as an individual to have
Yeah.
gotten this label or this diagnosis, but it's such a common experience.
Yeah.
Obviously, everything's on a spectrum. And so
Hmm.
there's healthy levels of anxiety, and then it can become more debilitating for individuals. But I think just having more conversations and normalizing the experience beneath the surface, I think, is really helpful.
Yeah, me too.
Yeah.
That's great. Okay, so most of the people who follow me, listen to my podcast, have panic disorder. I would say that's kind of the most common. There's also a lot of people who have generalized anxiety, some specific phobias. Could you kind of walk through anxiety disorders under this larger umbrella of anxiety and maybe just kind of describe them, and then also how they're similar and maybe some key differences too between them?
Yeah, absolutely. Yeah, so there's quite a few anxiety disorders listed in the Diagnostic Statistical Manual, the DSM. They all share a lot of symptoms and traits, and so sometimes there's overlap. Like, for example, panic attacks are something that show up in a lot of different anxiety disorders, and also may be present in non-anxiety disorders too.
Yeah.
Like panic attacks can occur in life, regardless of diagnosis. So, I can speak more to that in a moment here, but I think when people are most often talking about, oh, I live with anxiety, they might be referring to generalized anxiety disorder, which is a pretty commonly diagnosed anxiety disorder.
Okay.
It's beyond what we would consider kind of normal or healthy levels of anxiety, in that it is creating distress on the individual's life. But the anxiety and worries might be about a wide variety of topics. It's not specific to one thing. And there's kind of a frequent rumination, worries about the future, fears of the future. There's also panic disorder, which obviously you speak a lot about. And while panic disorder may be very linked with panic attacks, as I mentioned earlier, it's not the sole defining diagnostic feature of that disorder. Panic disorder comes up when the fears are specific to wanting to avoid having the panic attacks or avoiding the triggering situations that could bring up a panic attack. So often you might also notice significant fears of becoming crazy, losing control,
Yes.
fears of
Yeah.
dying, which I know you've talked about in past episodes. So panic disorder is pretty specific and unique to the fears of the panic attacks themselves.
Okay.
So social anxiety is also pretty common.
Yeah, I hear that a lot. Yeah.
A lot of fears that are more specific to the social interactions. In some cases, someone may even experience loss of the ability to communicate in the way that they're wanting to in social environments, just because the anxiety is so intense in those moments, but pretty specific to either certain social settings or just kind of socializing in general.
Okay.
Yeah, separation anxiety can be diagnosed as well. Often you may see this in children, of course, but
Sure.
can persist into adulthood or develop in adulthood.
I something that I experienced and also had heard a lot about really before I experienced it. I don't know if it's the same thing, but people just would call it monophobia. And what I've heard it mean literally is like the fear of being alone. And so maybe it's just slightly different from separation anxiety, but a lot of people, myself included, who have panic disorder, some anxiety, like end up having like a safe person that they can't be without.
Right.
Which feels like related to separation
Absolutely.
anxiety.
Yeah. There's a lot of overlapping experiences amongst these disorders. And I don't think I've heard of the term monophobia, but it might be as under the category of specific phobias,
Sure.
Which is also within anxiety disorders too.
Yeah.
Is just having a phobia, a really averse reaction to a trigger that's something very specific like that. And often it's exposure to something like a snake or something like that. But could potentially be present there as well in what you're describing.
Okay.
And then agoraphobia as well is one that fear of open environments, fear of,
Yeah.
often it leads to kind of just staying isolated in your home out of, fear of certain settings where maybe it's a fear of not being able to escape,
Yeah.
or not being able to get help or safety. So really in relation to where you are in the world, kind of that's where agoraphobia comes up. So yeah, and then there's some disorders that are not specifically labeled under anxiety disorders in the DSM, but are treated very similarly, which would include obsessive compulsive disorder, hair pulling, and skin picking disorder. Hair pulling disorder is also sometimes referred to as trichotillomania, or trick, TRICH. So if people are wanting to kind of look up, if they haven't heard that term before, there's a lot of resources out there for, and communities around those disorders as well, because it can also be pretty debilitating and really self-conscious inducing, and so there's some really wonderful communities out there. And then hoarding disorder is also treated similarly. There's also some overlap with post-traumatic stress disorder and certain types of like exposure treatments too, because the triggers and the distress are pretty similar.
Okay. With post-traumatic stress, I think people sometimes ask me about it and I just shy away from talking about it because I haven't had that experience. And to me, it seems like there's a lot going on there when you have a traumatic event. And with panic disorder, a lot of times it's not from a traumatic event, it's more like avoidance, like we've talked about kind of over time. Is post-traumatic stress disorder something that is like maybe you need more care in treating it or taking steps, or is that not true?
I mean, I can hear kind of where you're exercising caution around it because it can feel particularly sensitive in the nature of how the disorder is developed.
Yeah.
But I would say that, the experience of post-traumatic stress disorder or an anxiety disorder there could be as much care needed in the exploration of those disorders and the treatment of those disorders, just depending on how it's showing up for the individual.
Yeah.
Someone can live with chronic PTSD and have it fairly managed even without going to therapy or having exposure treatment around it.
Sure.
And vice versa, the same can be true for anxiety disorders, and also either of those could also be needed to be treated very thoughtfully and carefully, which is something that in my own practice I always am wanting to evaluate and consider in my own treatment approaches to any condition. There's my own competencies, and then there's times where I may need to refer out to someone who does some more specific targeted treatment work, depending on how the symptoms are showing up for the client.
Yeah. Okay.
Does that answer your question?
Yeah, definitely. Yeah. I think that's good to hear for people who do experience PTSD, because the kind of question or the tone in the questions that I get is often like, this is more complicated, right? And I think what you're saying is there's a scale of severity in any anxiety
absolutely.
disorder. So
for sure.
So I think that's a good thing to hear for people.
I think like if you were in your peak state of panic disorder and you were like, let's even just say the cabin trip as the example, like let's say that didn't end up with a positive experience or something, that could have completely caused you to regress in a certain way if like you pushed too much too quick or whatever, you know what I mean? If you kind of like went willy-nilly, or someone tried to like, I think sometimes people who don't understand the nuance of these disorders, or who have a lack of understanding, like maybe parents working with children who are experiencing anxiety, may not have this nuanced understanding of like, you can't just
force somebody.
Yeah, you can't throw a kid in a pool who's afraid of water. You know what I mean?
Yeah.
Like that's going to create trauma. And so there's likely an overlap in some of these disorders sometimes, that sometimes the anxiety is rooted in trauma. So yeah, I guess it's a kind of a complicated and nuanced answer, but I think
that's helpful though. Yeah. Okay, another thing I think would be helpful for people to hear and for me to hear is really about the mechanism behind anxiety. Like what exactly is going on in our bodies when we are experiencing intense anxiety or even a panic attack?
Yeah. Well, anxiety is adaptive to us. It is developed through, it's an evolutionary response to help us be cautious about potential threats, perceived threats. But oftentimes when it gets to this point of diagnosable anxiety disorder, that threat response might be really hyper-attuned and overactive in some ways. And so basically your brain is having a hard time distinguishing between a physical threat that might require serious action, like running away or fighting. So this is where the fight or flight response gets triggered, versus just a stressor that could be creating that similar experience in our minds and our body that may not actually warrant that response to come up. We don't actually need our adrenaline pumping to
Yeah.
and our blood flowing, preparing us to run away from a situation when we're just kind of thinking about an upcoming social interaction, right? It's your body is preparing you for action in times when maybe it's just feeling overwhelmed by the fear of that situation. This is your nervous system kicking in. And again, you'll probably hear this called the fight or flight response. There's also some other mechanisms that can come in here. So the freeze response you might have heard of, and also the fawn response.
Yeah, fawn, I heard for the first time recently. What exactly is that?
Yeah, so that's often can also come up around trauma, but it's instead of wanting to run away from the trigger or fight it, or just kind of in that paralysis freeze state. Sometimes it can become adaptive for someone in high stress situations to actually try to appease the person who might be triggering the distress internally. And so, like, if you think about a parent and a child, if the parent is the one kind of creating the feeling of emotional unsafety, the child might have learned to do things to appease the parent and decrease the distress.
Yeah, like in order to protect themselves, essentially.
Yeah.
Wow.
That often happens in gendered dynamics, of course, too. If
Sure.
there's kind of a male presence that's making a woman feel unsafe, you can often see that fawn response playing out.
Yeah, totally.
That's why sometimes it can be confusing, like why some behaviors might appear like, why are you being so kind to this man that's making you feel so unsafe?
Yeah,
I think
yeah.
a lot of women might be able to relate to that experience of,
Totally.
why don't you just shoot it down or be mean or cruel or something in
Yeah.
response? But that could trigger.
Because that's not your safety mechanism.
Right?
Yeah.
It could invite more danger or harm if you don't fawn.
Wow. Interesting. Okay.
When our nervous system is activated in that way, it is a very physical experience, as I mentioned. So, your blood is pumping through your veins, your heart is racing, and the adrenaline, you've got the stress hormone cortisol coursing through your body. And if that reaches a certain intensity, it can bring about a panic attack. And so that's where your body actually, you're starting to hyperventilate as a way of trying to induce the parasympathetic nervous system response, which is the calming response.
That's why you start hyperventilating?
It's your body's way of kind of creating those regulating hormones. And so after you've experienced a panic attack, you might notice that lightheaded feeling and just kind of like a crash. That's what your body did to help try to bring you down from that really escalated state. And so I think sometimes even having that understanding can be helpful, and maybe developing a different relationship to panic attacks, to understand, like, oh, okay, this is what my body's trying to do to help bring me back down.
Yeah.
It's feeling really scary and intense because it's at its peak right now. But through this process, my body is calming down again. That's not to say induce panic attacks in yourself to get yourself calm. The goal is to kind of proactively work against that, but you can reach some acceptance around it when you know that this is just your body's really miraculous way of trying to reach a state of regulation again.
Yeah, I love how you say that, and I have kind of explained before that I think it's really important to recognize what is going on, like what is a panic attack and why do they happen, so that you can practice acceptance. Because if you don't know you're having a panic attack, you think you're having a heart attack or a stroke, or that you're going to pass out or whatever. And if you really believe that that's true, like, you should get medical attention. You know what I mean? And so understanding what a panic attack is or could be for you, I think is a really empowering part of this whole process.
Absolutely. Yeah, for sure.
Okay. Kind of along these same lines, my language for this idea is I've said like neural pathways, or like I've heard it described as there's pathways in our brains that are sort of, it's a connection that's been made and that allows this fight or flight response to happen in a disordered way. Can you talk a little more about like what's exactly going on there?
Yeah, absolutely. So our associations with anxiety triggers can become really well-traveled paths that are kind of hardwired in our brains. It's our just like any habits in our life, or how we just really do anything. Our brains kind of have connections that based on associations that we make in our brains that reinforce certain patterns. And that's why, when you are developing a habit or trying to break a habit, it gets easier over time, right?
Yeah.
Whether it's positive or negative, unfortunately, it's just like becomes more well-traveled. And so
I love that metaphor.
yeah. The more well-traveled that path, the easier it is in our brains to kind of keep going down that same path. And that's why change can be so hard too, because you're introducing a new pathway and it's like, I've got this one that I already know about
It's easier.
really well.
Yeah.
And so, for example, with avoidance patterns with anxiety, that's the really well-traveled path.
Yeah.
Not leaving your house is known. And not only that, but it's almost, I'll use the term loosely, but kind of almost addicting, right? Because it's like you experience this relief from not having to leave. You worked yourself up, and then the thing that's offering the relief is choosing not to expose yourself to the distress. And so that's the well-traveled path. And so then the idea of introducing something different, even a small change, can feel really hard and overwhelming. It's unknown, it's uncertain, and
it causes a physical reaction.
Causes distress. Yeah, it's hard. It's physically uncomfortable.
Yeah.
But the wonderful thing is that our brains are really created to grow and change and recover. Even, you can hear of cases of someone who's experienced actual physical brain damage that is able to kind of regrow and reconnect. It's very flexible.
That's good news.
Yes, it's good news. And this process of doing something different and allowing your brain to build new connections and allowing that to become the new well-traveled path.
Yeah.
And then all of a sudden having that new well-traveled path replace the old one. That's called neuroplasticity. Our brains are plastic. And there's a resource that I can share with people too.
Yeah, I can put it in the description.
Yeah. It's a wonderful, brief little video that explains that process better.
Okay.
But that's kind of the underlying goal behind really any therapeutic modality that is here to help you introduce change into your life in any way, but particularly with anxiety.
Okay. I love that. Okay, so for all the different types of anxiety we covered, can you just touch on, I'd like to give people a sense for the different options of treatment. I talk almost exclusively about exposures and practicing non-responsiveness because that's what works for me. And so I'm speaking from my own experience, but I know there's a lot of different types of treatment available. Can you just kind of give people an idea of what's out there?
I think, specifically for more generalized anxiety, there's a lot of outpatient therapy treatment methods that are really any modality might be able to kind of support you with getting a basis. For example, there's behavioral therapies like cognitive behavioral therapy or CBT. DBT is dialectical behavioral therapy. That can also be done in a group setting. They both have their own kind of approaches to working with anxiety. A lot of challenging the types of thoughts that are reinforcing anxious thoughts. And then introducing, because you're thinking differently, then it introduces a different way of acting, which then changes your emotional state, and vice versa. Just kind of getting in at any of those angles and seeing how that introduces change into the system. There's acceptance and commitment therapy that really focuses on values and radical acceptance and mindfulness strategies, grounding, relaxing strategies of increasing presence, which is really needed with anxiety because we're so future tripping when we're in that anxious state. So mindfulness is definitely common amongst some of these theories. And then there's a lot of somatic therapy and polyvagal therapy. Those focus on kind of the mechanism that I was just talking about earlier about the nervous system states and work to support you on increasing your window of tolerance, your ability to handle distress and widen that range so that you can be more regulated and access resources that may be helpful through exposure to anxieties. And then one of my personal favorites is IFS, internal family systems theory. As I mentioned, I'm a very systemic therapist, and I apply that very literally to the individual. This kind of belief that that individuals are multifaceted too, that we have these different parts of us. And I'm sure that plenty of people with anxiety might relate to that this anxious part of them almost feels separate and distinct from how they view themselves in other areas of their life. And so the focus of this work would be really working with that particular part and exploring how basically you can work to not judge your anxious part, judge your anxiety, or like just like this idea of wanting to get rid of it
Yeah.
completely,
Mhm.
working through that in order to understand it differently, like how it's been adaptive to you and throughout your life and in different environments, and ways that anxious part can actually build trust in you as the leader of your system of internal parts
Mm.
to kind of guide
Yeah.
it and keep it safe in
Mm.
situations. So when you've described in past episodes like how you would work through, not just going to the hospital when you would have physical symptoms coming up for you, in that case IFS might approach that as like, I'm not ignoring the concerns from this anxious part.
Mhm.
I'm going to work with it to say, okay, we're going to kind of come up with an arrangement here that
Mm.
if after I do this exercise, if something comes up, maybe then I'm going to listen to this anxiety and take it a little more seriously and see if, there's other conditions that might actually warrant that level of distress. But
Mm.
I'm also going to be implementing these exercises to see if I can help reach a state of regulation. And,
Mm.
once you've got your parts buy-in, you can kind of achieve more of a state of calm and relaxation. And so, yeah, that theory would really identify some of this as kind of an internal conflict and struggle amongst your
Yeah.
parts. So that's my passion.
I,
Yeah.
I see why you're passionate about that. And I feel like even just hearing you describe that, which I'm sure is a broad overview,
Mm-hmm.
I feel like changed kind of the way I think about
Yeah.
anxiety a little bit. In the last episode, I talked about how anxiety and all of our emotions kind of have this like voice to them. And
Mm-hmm.
it's just really a different metaphor for what you're
Yeah.
describing. It's like this piece of us
Mm-hmm.
that's there,
Right.
and
Yeah.
anxiety happens to everybody. And
Mm-hmm.
with anxiety disorders, it's just out of order,
Mm-hmm.
and so as somebody who is prone to that, like you do have to accept
Mm-hmm.
that that is a part of you and then sort of working to maybe shape it to
Yeah.
to not be so loud or so overwhelmingly
Right.
present.
For
Yeah.
you to become kind of the leader of your system, and I could go really in depth with
Yeah.
this, but I'll kind of pull that back. But if
Yeah. Maybe we can do another episode.
yeah, we'll do a deep dive into that. But
Yeah.
there's certain traits of what we would call self leadership
Mm.
that you can kind of utilize as tools to help you increase that confidence in your ability to work with your parts.
Mm.
So
I
it's
love that.
really beautiful to see people connect with that model.
Yeah.
Not everyone resonates with this really kind of
Sure.
metaphorical language, but I think what's awesome about it is that it gives language to complex internal experiences that are hard to talk about
Mm.
otherwise.
Mm-hmm.
So those are some just very few kind of outpatient therapy models, particularly for maybe lower levels of care. They could also be working in conjunction with a higher level of care at the same time,
Sure.
potentially of like I've definitely worked with clients who are participating in more targeted exposure therapy, like through EMDR, potentially, eye movement desensitization and reprocessing, which is
Mm.
more of an exposure therapy modality,
Okay.
while also kind of doing more of the traditional talk therapy
Sure.
that I focus on.
Yeah. So they can kind of be combined too, depending on what's
Depending,
helpful.
yeah. And also the therapist preference, because not every therapist is
Mm.
comfortable working with you while you're also working with another provider.
Sure.
There's certain situations where it might be recommended and certain situations where it's not. So,
Mm-hmm. Okay.
yeah,
Yeah, that makes sense.
individualized.
One thing I wanted to talk to you about specifically, obviously we kind of passed notes back and forth before you came
Yeah.
over. Um, and one thing that you had written out was about exposure therapy specifically, and I know that's not what you specialize in. I have basically been telling people that they should just do exposure therapy, you
Mm-hmm.
know?
Yeah. Yeah.
And I'm curious to know because that's what I did. Like
Yeah, for sure.
I sort of did it a couple times with a therapist and it was very introductory. Like maybe I did one exposure kind
Yeah.
of thing. It was very introductory. And then there was another podcast that was really helpful to me. And I feel like I kind of learned the gist of it and I was like, I can try this on my own.
Mm-hmm.
And I went very slow and was careful, but I'm curious to know from your perspective, what are the risks of doing that? And like, why, I guess, do you think that it's something that should be done supervised? And if so, why? And what are the risks of just
Yeah.
kind of like going for it?
Yeah. Well, I would definitely be curious to hear an exposure therapist kind of perspective on that. But
Mm,
one thing that I know within kind of the therapist community is I think exposure therapists would definitely encourage clients to seek that support out first,
yeah.
likely because it is that targeted treatment. And you don't necessarily want to, I guess, I never think that it would be like a waste of time, but you don't want to waste your time doing like talk therapy, if ultimately it's maybe that is even an avoidance mechanism
Yeah,
to kind of
totally.
like not really start the really distressing part of the process. Not that talk
Yeah.
therapy, isn't also going to bring up some, challenging things to overcome in the
Yeah.
process,
But
but
anything can be avoidance. Just depends on your mindset.
yeah, and
Yeah.
so, a thoughtful talk therapist like myself is going to also be mindful of like, hey, this is an alternative treatment approach that you could actually really maybe go further in overcoming your symptoms through doing some exposure here.
Yeah.
And there's some limited cases that I might incorporate some elements of exposure into my sessions, but that's not my specialization. It's not what I'm trained in, and so I don't know if there would necessarily be a risk to starting with an exposure therapist because they are also going to be mindful and take their time to make sure that you're approaching it incrementally at a rate that feels comfortable and, well, hang on, not comfortable. It's going to be
Yeah, it's not
uncomfortable.
comfortable.
But
Manageable,
that's
maybe.
manageable, yes. And
Yeah.
that's not going to reinforce the fears and anxiety. So I think.
Yeah, that's a really good
Yeah.
point. Yeah, and I think that in my own experience too, that did happen to me a few times. Nothing that was really dramatic, but I got very excited about, I started to feel those pathways kind of changing
Yeah.
where, I was making new paths and then new things became kind of my default that were positive. And as I got kind of overexcited, sometimes I would overdo it and then maybe experience more anxiety in a certain situation than I had
Right.
previously, which can be very discouraging. But I think the positive note to it is that I also overcame it eventually,
And you had the skills and the tools to do so. So when you saw the anxiety increase, you already had the understanding and your brain already knew how to overcome that. And so
Yeah.
I think there's so much value in really the very experiential practice of exposure therapy that maybe talk therapy might be more limited in addressing. However, I would also say that sometimes like only focusing on the behavioral exposures, if you're noticing that you're still getting stuck or that there's some, resistance to that process, there may be some benefit in kind of some of this more introspective work that you might do in talk therapy, some underlying, some family of origin stuff that's coming up and getting triggered, or again, attachment wounds that make it hard, like beliefs that you're holding about yourself that might be making it hard to approach this process. And so I think that's where it's really helpful for these things to be happening in conjunction sometimes too. So there's a value and need for both ends of this type of treatment.
Yeah.
Some other treatment approaches that might be different than regular talk therapy, or even more of this involved exposure therapy, would be the group therapy setting or support groups. I think there's a real need to connect with others who are going through this as well.
Totally.
And of course, there's something very valuable for social anxiety to approach that through the group setting.
Yeah.
Talk about experiential learning, right? And changing your behaviors to be in a setting that's actually actively working through those social fears in a way that maybe feels a little less threatening because everyone else in the room is feeling the same thing.
Yeah, I can imagine that would be really helpful.
Yeah. And then inpatient options as well. If certain outpatient or community-based services haven't been helpful, this could also be determined with a therapist that you're already established with. Are there more of a longer term stay in an inpatient setting to apply these skills and have kind of a controlled environment to work through it, especially if the anxiety has gotten to the point of like even getting to therapy is like becoming too difficult, or if there's limitations that are making the work, like we need to reach stabilization before we can actually do some of this deeper work. And so sometimes that's an important consideration.
Yeah. People ask me a lot about medication too, and we don't need to get into that. But I think the inpatient treatment, as sort of similarly to medication, is I think in a lot of cases people want and need to get to this place of like a level playing field to be able to then do a single exposure. You know what I mean? And so I tend to think of those things as like support for like the work that you're going to be doing, and so different for every person. But
Absolutely. On the topic of medication too, an inpatient stay will definitely incorporate some element of medication evaluation. Usually they're going to assess to see, what are you currently on? Are you on anything at all? And give you some options. So I think it's a really nice like reset to just kind of evaluate what's working, what's not. Yeah, and to just feel like you've got some footing beneath you before you're diving into some of this other
Yeah.
work.
Yeah.
Psychedelic assisted therapy is also obviously new and still being researched. Not new in practice, but newer in, how we're embracing it in the field and recognizing the benefits. Again, also for more treatment resistant forms of anxiety, it can be, there's some promising studies that are showing that it can be helpful in kind of fast tracking in the facilitation of those new neural pathways being connected. That's what psychedelic assisted therapy typically does.
Okay.
And that also might not be recommended in every situation either. So there's evaluation that would occur to make sure that you'd be a good candidate for that approach to treatment.
Nice. Okay. That's interesting.
Some therapists will offer in-home therapy services, which can be really helpful for someone with agoraphobia, for example.
Oh, yeah. I did not know that.
Yeah.
Wow.
So obviously might be a little harder to find because it's more of a specialization or more of a unique offering.
Yeah.
But yeah, even in the Twin Cities here, there's in-home therapists.
Oh, wow.
And for clients who have medical assistance, there's even more options available to them. I used to be an ARMS worker. It stands for Adult Rehabilitative Mental Health Services. And it's not therapy, but it is mental health skills focused. And I would go in-home with clients as well. So more of that in-home support services. And I had a lot of flexibility to work through to basically put into practice some of these concepts of exposure with clients who were really struggling and kind of getting out into the community more and just kind of normalizing that in their routine.
Wow.
So
that's incredible.
Yeah, so really valuable work and may not be available in every state, but for Minnesota people, it's a great resource.
Wow, that's awesome. I love hearing that.
Yeah.
So we got coffee a few weeks ago and I was talking about, or somehow Carlisle, my other cat, came up.
Cutie.
And yeah, he's not here because he's terrified. But
Yes.
I've been I call it exposure therapy. And it kind of is, but I was telling you I'm nervous about like traumatizing him more because I keep giving him these treats when scary things are happening to try to get a new positive association. And, I was asking you like, am I going to re-traumatize him, or, is he going to associate these treats with fear? And you brought up how in people there's this, like, I think you called it window of tolerance, and sort of evaluating, you want to be at sort of a good, happy medium. Can you just talk a little bit about how that plays into anxiety?
This is a really important concept, and I think it kind of demonstrates what the value of having someone who specializes in this work kind of facilitate certain processes could be important. So that's not to say that no one should incorporate these concepts in any way on their own. I think the general understanding of like you have to invite some level of discomfort and distress into your system in order to grow and change, but not too much because otherwise it reinforces the change. I think it's that identifying like how much is going to be meaningful to allow me to start to introduce more change into my life without causing harm in the process. And as you spoke to earlier about your experiences when you got a little too big for your britches or something and you tried to it's easy to get excited and empowered and ambitious. And I think especially if you're working with a pet or something on this too, or a child, right? Like
when it's not you.
When it's not you, it's maybe even harder to determine, I guess, like how much is too much. And so I think this is where the window of tolerance is a helpful tool to understand, basically increasing your understanding of what it feels like to be calm and regulated, knowing what kind of associations you have in your body with that experience. And that's something that you can actually grow upon and expand upon so that you can call on that state of regulation when you might need it. But also getting really familiar with some of the early signs of distress. I think sometimes where people may struggle in this area is that they don't notice until it's too late that they're already in a state of anxiety or panic until it's upon you, especially if your baseline is somewhat anxious as it is. You might kind of ignore some of those indicators in yourself. And so I think some good practice for individuals at home, just understanding these concepts differently, is to just get familiar with what does it feel like when I'm in stress? What does it feel like when I'm calm and regulated? And for you, working with Carlisle, getting to know some of the body language signals too, of, or behaviorally, how does he show up differently? unfortunately, when with Carlisle, for example, you're not going to know maybe until it's a little too late that like, whoop, that was too much.
Yeah, yeah.
And so having to pull it back. And in this case, it's like you're exposing him to day-to-day life triggers. It's not like the harm that you could cause and trying to like increase his confidence is too great. But of course, if someone at home is trying to put some of these concepts into practice and the stakes might be a little bit higher, I think that's where it might be important to seek out an exposure therapist to support that process.
Yeah, and kind of help you find what that balance is.
Yes.
Yeah.
Yeah. So basically, yeah, the goal here is to widen the window of tolerance. Like, how much discomfort are you able to handle and manage without it kind of flying past the point of distress where you're no longer in control. It's hard to kind of put a metric to that, and so that's where the subjective units of distress score comes in, where it's a way of kind of labeling and putting a number to how much distress you're experiencing. And again, I think Amanda could maybe link in the resources. There's some SUDS thermometers, for example, or distress thermometers to kind of help you label and identify and maybe increase your understanding of different levels of distress you might be experiencing.
That makes sense. I want to say too that a lot of these principles and practices really can apply outside of disordered anxiety. And I say that because I was just thinking about this window of tolerance idea and how even just in my daily life, I used to work in an office every day. And so I'm, getting ready at early in the morning, driving to work, spending all day at the office, driving home. And I work from home now. And even like getting the energy to leave the house it takes more energy. And I was like, as I was thinking about it, I was like, my tolerance for this is low because I'm out of practice. And because mental health is so important to me and my other values too, like being out in the world and energetic, whatever is important to me. I was like, I'm going to coffee shops. I'm leaving the house more. Like I want my tolerance to be higher.
Yeah.
And so I just love that this is not just for somebody who's having panic attacks every day. Like it's something anyone can practice to make those changes like in the pathways in our brains and improve ourselves.
Another thing that comes to mind that really is relevant here too is with people who are struggling with anger or irritability. This is another kind of copy and paste kind of practice to help understand. Again, people who really do struggle with anger, they might describe like, I'm like 0 to 60 in a second. Like there's no, and I think they often feel very hopeless. Like there's no opportunity for growth or change here because it's like, it's immediate. It feels so out of my control. And I challenge them to kind of think back, like how in tune with yourself are you to understand that maybe it wasn't actually 0 to 60. Maybe there was a buildup. Maybe there was some, I also like this concept of vulnerabilities that we might experience in our life. If you haven't eaten anything in a while, you might, if you haven't gotten a lot of sleep that night, how much caffeine you've had, these are all things that might increase your vulnerability to experience anxiety or an anger episode or something. And it's all part of this process of what I basically just say is checking in with yourself, which feels like such an obvious concept, but it's kind of abstract when you think about it. Like, what does it mean to check in with yourself? And this is what I mean when I say that. I mean, kind of evaluating what are some vulnerabilities that might be impacting my ability to practice regulation right now.
Yeah, totally.
What else could be going on that could be impacting me that I'm not even connecting to the current experience? That's why maybe Carlisle might be doing great one day and not the next because like maybe he might struggle later tonight. It might be harder to do some exposure with him because I'm here right now. And
exactly.
That's throwing him off, So
the term I use for that is removing layers. Like sort of one of the tips that really helped me was, I call it removing layers because in my head, it's this visual of like armor that you're like walking around in is like this weighted suit.
I love that. Yeah.
And to work yourself up to doing exposure if you haven't eaten that day, if you're overtired, if something emotional already happened to you, you've got like a lot of layers on. And so kind of removing, and even like making your bed is removing a layer because you like don't have that visual stress or whatever you want to call it. So I like having a new language for it.
Absolutely. Yeah. Have you been to the Hewing Hotel?
I haven't stayed there. I've like eaten there.
There's a rooftop lounge.
Oh yeah.
This is like,
I haven't been up there.
Just went with friends. They don't really advertise this, but you can get like day pass to use their sauna.
Oh, yeah, you told me.
Yeah. Okay.
Yeah.
Oh yeah, I was gonna go the next day or something.
Yeah.
It was so fun. But in the
Nice.
sauna, they did this ritual. It's called off goose.
What on earth?
Where so you're in the sauna and this Aufgussmeister comes in
What?
and he like takes his hot towel and like wrings it.
Okay.
And it creates this heat wave. And it's got essential oils on the towel, and so it's like it smells good, it feels really nice, but it's hot. Like you're already in a hot sauna and there's this intensity of heat coming over you. And he kind of was guiding us through this meditation. You know, I feel pretty proud of myself. My two friends tapped out at a certain point because it was getting so hot.
Wow.
But I wanted
You
to
hung in
stay
there.
there. I hung in there. And what helped me hang in there was his reminder of like, this is a really intense experience.
Yeah.
But through this process of being in your body and experiencing this intensity and feeling yourself, oh, I don't remember how he phrased it, but it really tapped into something for me of like, oh, this is distress tolerance in action in this very physical way. I knew that I was listening to my body. I wasn't ignoring my body signals. This is kind of that internal parts work of I wasn't going to push myself past a limit of like, ooh, I'm actually gonna pass out or something here. But I felt like I was comfortable. It just was really hot. It was intense. And through him guiding us through this meditation, it felt like this experiential practice of distress tolerance. And I think that kind of underlies a lot of these treatment modalities.
Yeah.
And so, well, if you ever have the opportunity to
What is it?
Aufguss, to experience an Aufguss in a sauna, I'm probably saying that so wrong, but I'd highly recommend it. But even if not, maybe there's kind of a metaphor there of just like kind of experiencing this this wave of distress and knowing that it passes. And it was incredible after I left the sauna too to feel like, oh, I did that.
Yeah.
And, I felt really proud of myself. I also did have to leave I couldn't stay until the very end, and I was proud of myself for that too, that I wasn't just gonna,
just grit
look
your teeth
cool and for withstanding it. But
yeah.
Listening to my body, letting myself know when it was time to leave, but also, hanging in there longer than I thought I could, maybe,
Yeah. That's for me, I've experienced many of those things in smaller ways and also big ways. I think specifically about the first time I got in an airplane, that was my biggest fear. And I did it, and it was not easy, but I had built my way up, my tolerance to distress. And that feeling of like doing something that is distressful and pushing yourself to, further than you thought you could go is really empowering.
Absolutely.
Yeah. And kind of a euphoric feeling.
And it requires this surrender, this letting go of control, this, if anyone's interested in looking into this further, the willingness and radical acceptance. I think as you talked about acceptance in a previous episode, and I think those are really core fundamental concepts that are necessary, because you can't practice exposure. You can't increase your ability to tolerate distress if you're fighting or resisting the reality of the situation around you. So I don't know, just surrendering to being powerless. And this is where some existential things can come up too.
Totally.
So existential therapy can be another helpful modality here. But
yeah, hard stuff to practice, but very transformative.
Absolutely. It's meaningful growth. It's not just to overcome whatever is creating the obvious issue in your life, but it's proving to yourself that you can reclaim your life and make changes when things aren't working for you. And it's so empowering.
Yeah, agreed. Last thing I want to talk about is the use of the word recovery. So I use that word because that is meaningful to me, that word. I still have anxiety. I feel anxiety sometimes. I've even had a handful of panic attacks since I consider myself recovered from panic disorder.
Yeah.
What's your take on using that word? Because I know, I've been anxious since I was 5 years old. And people, talked about how there's no cure for anxiety, which I agree with. It's an emotion. And so using the word recovery, I think, is confusing to people sometimes because they picture a certain outlook that maybe isn't going to be a reality for them. So what's your take on that?
Yeah, I think language is incredibly personal and individual to every person. I think this is why certain people who have experienced traumatic events in their life may identify with the term survivor, and other people might want to claim the word victim, depending on the circumstance. Each term has a very different meaning, and there's no right or wrong answer there for each individual and how they relate to it. And so if recovery is meaningful to you as a term, absolutely use it. It represents a part of your journey. For me as a listener, I hear you describing recovery as like, this was my journey and something that I overcame in my life and I'm proud of. Like, there's so much attached to that term.
Yeah.
And, also hearing you describe more about why you use that term, and also that you don't have this belief that because you have reached recovery for yourself, that means that you're no longer going to experience anxiety. I think that's helpful nuance, and people may have a reaction to hearing the term recovery if there isn't that kind of that further dialogue about what that means to you as an individual. Yeah, I think as a therapist, I don't tend to identify with that term for my clients, because I maybe am more focused on wanting my clients to have a realistic understanding of how anxiety might be present throughout their lives, and don't want them to get the understanding. I think coming from a clinician, that might have a different impact or land a little different if I say, oh, you've recovered,
Yeah, totally.
So I think, I guess a more clinical term might be like in remission, or I guess, or finding even other language that even comes up naturally in my sessions with clients to describe the outcome for their life that they're hoping to get. That's maybe more what we might land on more often than not. I guess my answer there is that language is deeply personal. And I don't think there's a one-size-fits-all way of talking about this. As long as everyone's open to kind of having the dialogue required to better understand one another and how everyone's experience is unique and different.
Yeah, I think, I mostly wanted to get your take on that because, as I always tell people, I have a disclaimer in almost everything I do that I'm not a therapist, I'm not a clinician in any way. And so this is very experience-based, but at the same time, I don't want to put anything out on the internet that is potentially harmful to people. And so, I do think recovery, I use that word all the time, and it is very personal to me. And I'll keep teaching people why I use that word. But so thanks for that explanation.
Yeah, and I think, for each individual, kind of reflecting on what resonates with them. What are they working towards? And I think what's more valuable than just one singular word that you could reduce that end outcome down to is more of really exploring what will your life look like and what feels realistic. How do you want anxiety to be integrated into your life in a way that feels more manageable? And again, relate to that anxiety differently. How do you want to work with your anxiety when it comes up? Because I think it does paint a realistic picture. It can feel really empowering when you aren't just thinking about some made-up person in your mind that has achieved complete optimal peace and never is affected by anxiety. Yeah. That feels really discouraging.
Totally.
Yeah. It doesn't feel attainable. So
yeah. Okay, thanks. Okay, well, thanks so much for being here.
Thanks for having me.
For sure. Yeah, I feel like I learned so much just from this one conversation.
Good.
I mean, I'm always talking from my own experience, which I do think is valuable to people. That's what was mostly valuable to me in my recovery journey, was other people's experiences. But of course, there's so much information that has been studied and researched, and there's processes for this. And so hearing that side of it from you, it kind of feels like it puts the whole puzzle together. And I think will be really helpful for the listeners.
That's so great to hear. Thanks so much for having me on. I love having the opportunity to talk to people about this, especially if they're kind of on the fence about exploring therapy and maybe don't know what all their options are or what to look out for. So thanks for the opportunity to do that.
Yeah, for sure. I hope that was as helpful to you as it was to me. I feel like I learned so much in that conversation, and I'm excited to apply some new practices and principles in my own mental health journey. If you enjoyed the podcast, please leave a quick review. It's really helpful in other anxious people finding this resource. If you have questions about anxiety or mental health topics in general, please send me an email at amanda@the18minutes.com. I would love to hear from you. Thanks so much for being here, and we'll see you next time.